day, and I wish that our students, faculty members, and other will get enlightened by your various valuable speech. With this, I will hand over the session to Dr. Radhika ma'am.
Good morning. Today we are going to think and act about community connect, pharmaceutical care everywhere. What is the hidden meaning of this? I ponder myself and find out that.
Hello, can you hear us?
The pharmacists across the world are known to associate themselves with the patients directly, face to face, especially in the community pharmacy section. In our country, we don't have such a system, and the problem here is the pharmacists are divided house. Pharmacy is a divided house. For example, the pharmacists who work in industry, they are different. We don't know what is happening to them. But the pharmacists in the teaching, they are also different. Pharmacy who have done open medical shops, they are also different. Pharmacy regulators, they are different. So these differences have caused much harm, and we do not know what is happening in the other area. So as a result of it, this type of situation we are facing, and public is not aware what pharmacy is. Although we take jatas, we conduct awareness program and all those things, we need to do something more. We need to do something more to the patients. This can happen when we interact with the patient. So where to interact and how to interact? The point of interaction is the community pharmacy. The medical shop is the ideal one where the pharmacist will be there. So all your teachers are registered pharmacists, isn't it? So they can do a wonderful service to the public. And they can earn more money also along with the services. Because nobody likes a free service to provide or to take. So as a result of it, we are blessed with the Government of India's Act in 2015, that is Pharmacy Practice Regulations 2015. Can you please put the first slide? This is not the first slide. A gazette notification. Yeah, this is the gazette notification by the Government of India, which is in the English in the later part, but in the Hindi in the beginning. And further, we will go to the definitions. So, what is pharmacy practice? The pharmacy practice means interpretation. What to interpret? What is written in the prescription, that has to be interpretation, is to be done by a pharmacist. And evaluation. You have to interact with the patient and find out what exactly is it. Everything you cannot understand by reading a prescription. So you have to interact with the patient. Then you have to evaluate what is the patient understanding about the medicines he is using, whether he needs other information. That one you must work out, and you have to do the implementation. So the three terms are there: the interpretation, evaluation, and implementation. So all these things have to be done in a proper sequencing manner. So further, this Pharmacy Act in that only the Pharmacy Practice Regulation 2015 is a part of it. They say that the pharmacist, the registered pharmacist, can participate in the drug and diagnostic choice, because the pharmacist may have a better idea to suggest doctor about the the drug and the devices used in this thing. See, you are simply changing my slides. I not yet completed. The first slide. Yeah. No, not this. Second one. Yeah. So we are empowered with this law. We can give suggestion to doctor about the drugs in the prescription. So we can ask the doctor to change by giving a proper reason why the drug should be changed. That has to be explained to the doctor, and he will do it. And should check the doses, whether the doses the patient has understood how to use the medicine. And then after implementation, the things will go on, and they were also allowed to do vaccination. Recently, the vaccination rights were provided to pharmacists. But after the training, but training is also about one day or a few hours training is there. After that training, a registered pharmacist can give vaccine, because nurses cannot give vaccination always. So you can also learn some nursing skills along with the prescription skills, and you have to work in close association with the doctor and nurse. You may substitute doctor, you may substitute nurse. Both are eligible. That's what this law says. Next slide, please. Can I have the next slide? Please change the slide. Hello? Change the slide.
Yes, sir.
This is the slide. You remain here till I say don't change. So what
Yes,
is
sir. Okay.
code of ethics? Code of ethics is the dharma rakshita rakshitaha. Suppose you are a dharmist. It means you follow the good practices. Do no harm. Do good to the people. People will be observing all the pharmacists, and they will draw a conclusion. Oh, this person is a good person, and we must go to him. He will not cheat us. So if you are cheating type, if you hide and the prescription with the drugs and all, when the patients are the health consumer,
Hello, sir. Sir, it is not audible, sir.
now I'm audible.
Yes, sir.
So whereas my father also was a pharmacist, and he opened the medical shop in 1954. In those times, the Karnataka government, I belong to Karnataka, Karnataka Drug Control Department was established, and they called the people who could read English to become pharmacist within 3 weeks. So such a nice opportunity my father had. So they had to go to Bangalore and listen to the lectures for 3 weeks, and they will be given.
Sir, excuse me, sir. You are muted again, sir.
Registered pharmacist again. I will be looking at it. Don't worry. So registered pharmacist again. He was. He has no idea about the drugs. Within 3 weeks, how can we learn? Within 3 weeks. Somebody is muting me. You please stop that. Somebody is playing mischiefs. Because I am not muting. Someone is muting me. Please find out who is that fellow and ask him to behave properly. Okay. So further, what happened? The things went on, and he has no idea about the medicines because SSLC dropout. My father was, so he was given a 3 weeks training.